Now, the steps in conducting a systematic review. Actually, there are 4 phases. It is done in 4 phases. The first one is assess need. Now, before you do a systematic review, you have to assess the need, whether you need to do it, whether there is a need for a systematic review, right? So assess need, then assemble team. Again, when you assemble the team also, now here IOM standards, Institute of Medicine, USA standards. According to the standards, you should have people in the team. And then create protocol. The next phase is creating the protocol. That is the pre-plan. This is the most important part actually, because now we prepare the pre-plan, and then when you do the when you conduct the review, you just follow the plan. It is just following the plan. So when you plan it, you need to include everything in detail in the plan. Okay. So actually, when you create the protocol, again there are guidelines. It is called PRISMA. P is for protocol. PRISMA guideline. PRISMA means Preferred Reporting System for Systematic Reviews and Meta-analysis. P for protocol. So you have to follow. I mean, you have to have the guidelines have to be followed when you create the protocol. Okay. Now in the protocol, there are 9 areas to address. So we will be going to all those. And then after creating the protocol, the second phase, the third phase is to conduct the review. This is again, standards are there. You need to follow the standards, and you just follow the protocol. And yeah, again, the 9 areas are from these 8 steps. Okay. And the last phase is update the review as needed. Okay. So after doing a systematic review, after some time, actually, it is recommended that it has to be updated. So we will be talking about those later, right? So this is the just an overview of the steps in the thing, right? So standards of systematic reviews. Right. Now I'll just show you few items of the systematic standards, right? Hello, Shanta. Is it okay? Are you all? I mean, you can see everything. You hear everything?
Yeah, madam.
We are okay, madam.
Right. Okay.
Yeah.
Right. Yes. Right.
Yeah, okay.
So.
Yeah, okay, madam.
All right. Okay. Right. So now I thought to just show you a few items from the guidelines standards, right? Now, for example, standard 2.1, establish a team with appropriate expertise and experience. Include expertise in searching for relevant evidence. That's for an example, right? And then this standard, develop a systematic review protocol. Describe the search strategy for identifying relevant evidence. So everything is there in the standard. You'll have to just follow those. Conduct a comprehensive systematic search for evidence. It's not just a literature search. Okay. And there is a methodology. So work with a librarian or other information specialist to plan the search strategy. Okay. So document the search strategy. Provide a line-by-line description of the search strategy. Now see, now all those have to be followed. Now this I'll have to mention. Now actually this is 2015. In 2015, IOM, they changed their name. Now it is Health and Medicine Division, HMD, National Academies. Actually, IOM is also from the National Academies of USA, and now they changed. Now it is the HMD. So in future, when you look for standards or IOM standards, now you will maybe, I mean, still it is there, but in future, yeah, it might be HMD. Okay, so I just wanted to mention that. Right. So now we come to the complete process of SR. Right. As I said, the first one, assess need, assemble team, then create protocol, then conducting the review. Now, when you conduct the review, there are steps. Okay. Now, first one is the literature search, because now you want to find the subjects for the research study. So subjects are coming from the literature review. Okay, subjects are a pool of studies. So the first thing has to be, after creating the protocol, then literature search, find all relevant evidence, documents, all types of these, right? But you'll now during the process, you'll have to, according to the subject area or according to your topic, you can decide whether you are going to take all the types. Okay, you can limit. You can decide on the types of studies that you want to take. Okay, it depends on the study area and the topic, right? And you need to look for all relevant material. You have to have a look at current awareness and search updates. And then in the literature review part, you will have to have a reference management system, because you will be dealing with a lot of references. So there should be a software to manage your references. Okay, like Mendeley or something like that. Okay, and then also there should be a way to obtain full text documents. Okay, right. So that is about now the person who will be doing the literature search has to consider all this, right? And then it comes now, after finding the relevant articles, then select studies. That means now in the literature search, you search, I mean, we look for the relevant articles, right? So you will be ended up with lot of articles. Normally, in my experience, actually, when normally it's about 1,000 or nearly 1,000 articles we get after a search, right? And now we are not going to take all those, we are not going to consider all those articles. Out of those articles, we need to select the most relevant ones using an inclusion-exclusion criteria. Okay, right. So select studies, this next step. Now, inclusion-exclusion criteria, we'll be talking about in creating protocol. Okay, so using this criteria, you select articles out of those. Okay, and then you extract data from those selected articles. Okay, but actually now in the it's okay now in the procedure, it is data extraction is before assessing quality. Okay, but it is okay if you have the assessing quality first and then extract data, because now after you select the studies, now when you do the quality assurance, you will be removing some of the articles. So therefore, you can extract data only from the articles that you are taking after assessing quality. Okay, so so those are the steps: select studies, then extract data, then assess quality, and then after assessing the quality, then you use the findings of those articles data synthesis for the data synthesis. Okay, so it can be a meta-analysis, because now if the articles have all the findings with statistical data, then you'll have to have a meta-analysis. Okay, when those are not statistical data but descriptive data, then you can do a narrative synthesis. So it depends on the types of articles that you are using, including in the review. That you have to select whether it will be a meta-analysis or a narrative synthesis that you will have to do, right? And then now after doing the synthesis, then describe results. At the end, you in the discussion, you'll have to say now what is your conclusion? What do you say? Now what is wrong and what has happened? Okay, because now we started with a research question. We had a problem. Okay, so at the end, now you should be able to discuss what exactly has happened, what has gone wrong, or what has to be done next. Okay, so describe results. Oh, I lost my mouse. Right. Now describe results and then archive review data and material. That is also part of the procedure. All the material and whatever we do has to be documented. It has to be there as archival material. Okay. And some journal publishers, when you submit your systematic review paper for the publication, they would ask for supplementary material. In supplementary material, some of these data they will ask for. So you need to have everything documented and archived. That is an important point. And right now, this is after doing this synthesis, writing the discussion, and now you write the report. That means to disseminate how you are going to disseminate, whether you are going to have a journal article or whatever, right? Writing the report of the systematic review. Now again, when you write the report also, there is a standard. You have to follow the standards, PRISMA guidelines. There is a guideline, you'll have to follow that, okay, when you write the report. Then finally, disseminate findings. That is also important, because now after doing a systematic review, it's no point keeping it to yourself, but you'll have to send it to the authorities concerned with the results, right? Or else you'll have to publish it. And then update the review as needed. Now, we will be talking about this later, why you need to update a review, right? We will come into that. So this is the complete process of systematic review. And now we will go into the details. Because now we'll have to talk about many things in each step, right? So now that I have outlined, now we'll go into the details, right? Now, first is assess need. Okay. How important is the question is of interest? Are there existing reviews? Actually, right? So do you actually need a systematic review to be done? Okay. Are there any existing reviews? If there is any existing reviews, actually, there is no point doing it again, because it's the same thing, unless there is some methodological issues in the review that has been done. So therefore, the quality of the outcome cannot be relied on. In that case, if that is not done in the proper methodology, then you'll have, it's okay to do another one with the proper methodology. Okay, so if there is one, do they meet quality criteria? You'll have to assess. Now this is the assess need. And do they need an update? If there is a good quality SR, see whether it need an update or a new systematic review. So that is the need for the SR, right? And then assemble the team with needed expertise. Normally, these are the expertise in the guidelines. SR methods. There should be a person who is conversant about the methodology of SR. Okay, and then a person who is experienced with the information retrieval for the literature search to be done, because it is the most important part, actually, one of the most important part, because you need to do a very thorough, comprehensive search to get all the relevant articles. Okay, so there should be a person from that line, and then of course the subject expertise. Subject expertise could be any number, the people who are experts in the subject area. And then if you have to do a meta-analysis in the synthesis, then you need a statistician also. Okay, so there should be people, actually now even subject expertise will be the people who are conversant with the SR methodology. Okay, so subject expertise They could be from this group also, right? Right. So now the first thing is to assess the need, where to find existing protocols. There are places where you can find the existing protocol. One is Cochrane Library. Actually, Cochrane Library has all the Cochrane reviews. Okay, so you can do a search through Cochrane Library on your topic, whether to see whether there is a already done a systematic review. Okay, and detailed review protocol are available from this site also, because now Campbell and Cochrane organization is the organization actually who have first worked on systematic reviews, and they are the people who have established all the rules and guidelines and everything, right? So this is one place. Actually, PubMed does not contain Cochrane protocols, right? Now, there is another site like this, Prospero. Prospero is the International Prospective Register for Systematic Reviews. Okay. Now, it is advised, now this is the URL, it is advised that whenever you do a systematic review, you register your systematic review in this registry. Okay, so that means this register will have all the systematic reviews which are being reported, which have been registered. So you can check in that register also whether there is a systematic review in your topic. Okay. Right, and of course there are some journals here, BMC Systematic Reviews journals and BMJ Open. Right. Now this is the system Prospero website here. Now you can register your review there, and also here you can search for systematic reviews on your topic from here. Okay. So this is again the description in Prospero. From October 2019, Prospero will require earlier registration. Okay, well, it says 1st October 2019, we will only accept a review provided that that data extraction has not yet started. Okay, actually now when you register your systematic review in the Prospero, you do not do it at the very beginning, because you have to register your protocol. Now, I mean, you haven't done the systematic review yet, right? So you only have the protocol. So you register your protocol there, and in the protocol you need to specify everything, right? So actually, it is difficult to specify everything in the protocol in the first part of the review, because during the process there might be instances where you need to deviate from the protocol for some very few reasons, right? So therefore, normally actually people register their systematic review in Prospero just before quality assurance. Okay, now it says now they don't accept after data extraction. Okay, right. So now we will start the methodology in detail. Now we went to the assess need, the first part, and now the second part is creating protocol. That is the pre-plan for the entire process. Okay, so SR protocol sets out in advance the methods to be used in the review. That is the important thing. Methods to be used in the review with the aim of minimizing bias. So you will have to take all the precautions, and you'll have to indicate those ones, how you are going to minimize bias during the process. Okay. So when you create the protocol, you will be dealing with all those. So the protocol itself describes the steps procedure of SR. So that is why I will be going through the protocol, because then I'll be talking about in detail about each step when you go through the protocol. Okay, so creating protocol, now it says decide if the SR would be registered at Prospero. It is encouraged. It is that. Okay. Actually, now when you register the protocol, again, they will expect it to be the protocol to be in the Prisma format. Okay. So now key areas to cover in a protocol. Prisma, according to the Prisma guidelines, now these are the areas that you need to give all the details. Okay. First, background of your study, research question. Okay. And then review question and review team. Now, okay, now we are going to go into details in those. So review question, then defining inclusion exclusion criteria. Then only identifying research evidence, literature search, study selection, data extraction, quality assessment, all that, right? Yeah. Okay. So systematic review CRD guidance for undertaking reviews. I mean, this book will give all the details. Okay. So now creating protocol, we are going to start according to the Prisma guideline. Okay. First one in the creating of the protocol is the developing the research question. Actually, this is very important. Actually, now with my experience in all my research systematic review projects, to finalize the research question took a long time. I mean, we had to change it from time to time due to several reasons from time to time, right? So anyway, now when you do the research question, when you develop the research question, again, there is a methodology. Okay. So methodology is break the review question down into sub questions. It can be framed in a model called Pico, PICOS or PICOST, okay, format. Now your question should have these elements. Okay. Population, P for population. What population is studied in the study, right? And then intervention. Now I is for intervention. Now intervention is something when you, as you know, in the healthcare, intervention could be, you are checking some drugs or some healthcare practice or something like that, some intervention. Okay, so you are checking the effectiveness of the intervention. Okay, so now questions will have some other types of problems also, not only the intervention, right? So instead of I here, you can have any other question types. It can be an exposure to something, or etiology. You want to find the etiology, cause of the disease, or prognosis, or frequency rate, or something like that, right? I mean, we are coming to that later. So I can be replaced with other types of research questions. Okay. Somehow, now this component should be there. Intervention or some other should be there in the research question. Okay. And then comparison. If it is an intervention and if it is a randomized control trial, then there would be a comparison component. C should be there. But some in other studies, observation studies, cohort studies, I mean, there won't be any comparison. So in that case, C is not there. So it's okay. Right? And then outcomes. In the research question, you need to have the outcomes. What outcome are you interested in? What are you looking for? Okay, so those items should be there in the research question. And also not timing. You can have a duration. So if you have a duration for your research, then you can have T there. And S, you can have S. S can be either study design, because you can specify the study design. I mean, you are using only the cohort study. You are using only the control studies like that. Okay, you can specify the study design, and also it can be setting also. Okay, now if you are doing a research using the subjects from the Eastern University, then S is there. Okay, so in the research question, those elements should be there. So you have to identify those in the research question. So as I said, there are 5 different question types. Instead of intervention, it could be or any of these. Okay, so intervention is an effect of an intervention on an exposure. Then frequency rate or a condition or a disease or a phenomena. Okay, and diagnostic accuracy, or else it could be a etiology or risk factors question, prediction, prognosis, or about people's experiences, etc. So it can be any of these. I mean, in the research question, that component should be there. Okay, right. So now we come to the next item in the protocol, defining the inclusion-exclusion criteria. Defined before final search is conducted. Okay. Actually, when you do the research literature search, you first do a scoping search. We are coming to that later, right? We'll go through that. Okay. So now here, what he says, this criteria should be developed before the final search conducted. Now this is why we need this to winnow out studies retrieved. Winnow out the studies. Now we will be retrieving a lot of articles to select out of those, winnow out, right? And always this criteria should reflect the research question. Okay, and also it should reflect the desired scope. Okay, if you want the broad scope, broad, it should be. If you want the broader one, it should be there. Narrow. So in the criteria, you have to have that. Okay. Normally, the common criteria, in a common criteria, these are the items that will be considered. Okay, so common population characteristics. Okay, so regarding population, now you can say, okay, it should have more than 100 participants. Otherwise, we are not taking. Okay, so that's the inclusion-exclusion criteria. It has to be more than 100 participants, like that. Okay, so if it is less than 100, said, and then no. If it is more than 100, yes. And then intervention details, that component, intervention or etiology, or details pertaining to that component. Okay, so you'll have to decide what you are including in the criteria. Okay, and now then the language also you can decide whether you are going to take only the articles published in English. You can decide. Okay, and then study type, as I said earlier, study type, and also publication type. That also you can include in the criteria, but it is a sort of a bias. Okay, publication type. If you are limiting it to the journal articles only, it is a very highest bias point. Okay, so there will be some articles yes, some articles no, but there will be some articles according to the criteria you may not be able to decide at first. In that case, actually, now there should be a way. I mean, we are coming to that later. Yeah, okay, we'll come into that later. Okay, right. Now the next protocol, the next one, the literature search. Again, the CRD guidance is there. Right, this is what I said. Now do a scoping review first. Scoping review is just you take the main keywords and then just do a search to see how it is. I mean, to see an overview of the literature that is available. Okay, by looking at that, then you can decide even the research question will be changed after looking at the literature pool. Okay, so you first do a scoping review, and then look at the, you can have an overview of the literature available. Actually here, methodologically accepted and good practice to refine the review question, right? So the person who is doing the research literature search should always be in contact with the subject specialists. Okay, so only the person who is doing the research, I mean, he or she cannot do it herself. She has to always contact the subject specialist, and they have to discuss and see whether those have to be taken or not, right? And now after doing a scoping review, then you will have an idea, okay? And even from those articles, that you found in the scoping review, you can get some keywords, search terms. Now, the next step is to identify the key search terms based on Pico. Okay. Now, it has to be based on the Pico. Now, you have the research question. You have Pico items. Now, according to Pico items, you try to identify the key search terms. Okay. So, some of these search terms can be found from the articles that you found in the scoping review. Okay, so actually I will show you this. I'll be showing you this. There is some document I can show you that. Now, when you have identified the key search terms, then you find the likely search terms synonyms. Now, those are the likely search terms, synonyms to those terms. First, you find the key search terms, then you find the synonyms and also some related terms. Okay, they're all those based on the Pico. So all those words you'll have to use for the search. Right. Now again, search is done according to a methodology. Okay, and here create the search term harvesting table prior to search. Create the search term harvesting table prior to search. Okay, for you the harvesting table after we finish with the protocol, and then use the methodology specified in guidelines for the search. Okay, and methodology, now those guidelines guidelines say that we need to search all the relevant databases if it is possible. Okay, all the relevant databases and current awareness search updates.